Welcome back to Gentle Dental. I'm Dr. Sarah Chinnery, and today we are going to be talking about what a tooth is made of. So grab your favorite mug and settle in. Today we are talking all about teeth, what they're made of, how many we have, how they change as we grow, and the different types in our mouth. So what is a tooth made of? Even though teeth look pretty simple from the outside, there are three main components: the enamel, the dentin, and the pulp. For the enamel, it is the outermost layer of the tooth. This is the part that you see when we smile. It's actually the hardest substance in the human body, even harder than bone. Enamel is made mostly of minerals, calcium and phosphate, arranged in a crystal structure called hydroxyapatite. Its main job is to protect from chewing forces, temperature changes, and acid from foods and drinks. One important thing to note is that enamel does not regenerate. Once it's worn down, we can't add it back, which is why prevention is so important. The next layer is dentin, and this is the middle part of the tooth. This is actually what's made of most of the tooth, okay? So dentin is slightly softer than enamel, and it's made of minerals, collagen, and tiny microscopic tubules. Those tubules actually connect to the nerve, which is why when dentin is exposed, you have a lot of sensitivity to cold and sweets and heat as well. Dentin supports the enamel and helps absorb chewing forces. The inside of the tooth is the pulp, and that is like the living part of the tooth, okay? So the pulp contains the nerve, blood vessels, and connective tissue. This is what allows the tooth to sense temperature and pressure and helps it stay healthy. When bacteria reaches the pulp, that's when an infection or significant pain can occur. Now we're going to talk about the difference between primary teeth and permanent teeth. So primary teeth are kids' teeth, that's the baby teeth that we see, and then permanent teeth are the adult teeth that we call it. Baby teeth and adult teeth are built similarly, but there are some differences. I'm going to call them primary teeth because that's what their actual name is. So primary teeth are smaller. They're usually a lot whiter. They have actually thinner enamel, the outside part of the tooth, and their pulp chamber is relatively large in comparison to the adult tooth. Because the enamel is a lot thinner, it's a lot easier for the cavity to progress a lot faster in kids, which is one important reason why going to the dentist is really important so that we can catch those early. Primary teeth are extremely important for chewing, speech development, and guiding permanent teeth into their position. Children usually have 20 primary teeth. So usually there's 10 on the top and 10 on the bottom. In a second, we'll talk about the age range when we're supposed to get them, but let's move on to the permanent teeth or the adult teeth. So for the adult teeth, there are 32 permanent teeth. They are usually larger, usually darker in color, maybe a little bit more yellow. They have much thicker enamel, and they are built to last a lifetime. As I mentioned before, we're supposed to have 32 adult teeth. So 16 on the top and 16 on the bottom. That is including your wisdom teeth. But do note that every person is different, and so some people won't have all of their wisdom teeth, some may have more, it varies, but the average is 32. Let's move on to the different types of teeth. So with that said, not all the teeth are shaped the same because they have different jobs. Let me grab a model here. So this is an example of adult dentition for the lower teeth, okay? So as you can see on the back, we have the molars, and then we have premolars, and then we have the anterior teeth. When I move to the primary teeth, you can see that this actually has your 6-year adult teeth, and then we have our primary molars, our canine and anterior teeth. So as you can see, a lot of difference on the size. But with that said, so in the front are your anterior teeth. These are called your incisors. And then on the tip here, those are your canines. And these are meant for slicing and dicing. So biting into like an apple, tearing food, helping with speech and appearance as well. When we move on to the premolars here, these are helpful for chewing and grinding. And note again, primary teeth do not have premolars. And then in the back, we have our molars, and these are our main chewing teeth. So again, primary teeth, this is our adult's first molar, but these are the primary molars as well. Whenever we're looking at the differences, so typically those adult teeth will come in in the same spot as the primary. Spots have them in this area here. This is your primary molars. Those are actually in place for your premolars. So that's what comes in around age 11 and 12. And then around age 6, we have our adult molars that are coming in, and they actually sneak in behind your primary molars. So most parents actually don't realize when kids get their adult teeth because they sneak in behind, but those are really important for spacing. If we lose primary teeth early, a lot of times we have a collapse. So like if we have our 6-year molar and we lose this tooth here, a lot of the times that molar will actually come in forward because there's space for it. And if we don't have a space maintainer or anything like that. But with that said, that tooth, then the premolar won't have space to come in. So spacing is really, really important for kids. And so if they do lose teeth early, please talk to your dentist to see if there's options to maintain that space while the kid is still growing. So let's talk about when kids get teeth. So typically around age 6 months is average, and they will get these little bottom teeth. And then usually around age 3, they'll have all of their primary teeth. And as I mentioned earlier, these 6-year molars usually come in around age 6. These here on the adult teeth, and then behind here are 12-year, and then those are our wisdom teeth. So the second molars or 12-year molars come in around age 12, and then the wisdom teeth usually come in around like age 17 to like even all the way to age 25. And it's really important just because of our diet now. Back in the day, they ate a lot of more hard food, and so our jaw was a lot stronger and grew more. And so because our diet has changed over the years, there's usually not enough room for the wisdom teeth to come in. So a lot of the times now, we catch them early to get them out so that there's not any issues with the teeth in front of it, and that they're not growing too much so that they're not affecting the nerve that runs alongside the jaw. Let's talk about when children start losing teeth. Typically, we start losing our baby teeth in the front around age 6 or 7. And then as I mentioned earlier, so the 11 and 12 age is usually when we lose our molars, and that makes room for those premolars to come in. I do feel like it's really important to understand why the teeth matter. It's not just like an aesthetic thing, but it's a function thing and confidence thing, as well as it's a space thing. It helps people stay healthy. Everything, again, is connected to your mouth. So if you don't take care of your teeth, you will have sensitivity, you can get infections, and your health can decline. So it's really, really important to take good care of your teeth. If you haven't watched Dr. Taylor's interview about primary teeth, please go do that because she had so many good insights. But a really important thing as I'm looking at these primary teeth, anytime that we have no spacing between our primary teeth, that's when we have to start flossing. So teeth aren't something that we just have. They're living structures that change with us throughout our lives. If you've ever wondered why dentists talk so much about enamel, baby teeth, or timing, now you know. If this kind of education is helpful, let me know what you'd like to learn next. Thanks for watching Gentle Dental. Please subscribe, comment, like, all the fun things. Thanks for watching. Bye.